Meaningful Use Reports number 17, Clinical Lab Test Results. The best way to comply with this measure is to establish an electronic connection with your most commonly used reference lab. This connection is usually paid for by the reference lab. Please contact Waiting Room Solutions to initiate this process if you have not already done so. Objective: incorporate clinical lab test results into EHR as structured data. Measure: more than 40% of all clinical lab test results ordered by the EP during the EHR reporting period, whose results are either in a positive, negative, or numerical format are incorporated in certified EHR technology as structured data. Denominator: number of lab tests ordered during the EHR reporting period by the EP whose results are expressed in either a positive or negative affirmation or as a number. In WRS, this is measured by the total number of completed orders in CPT code range starting with 8. Numerator: number of lab test results whose results are expressed in a positive or negative affirmation or as a number which are incorporated as structured data. In WRS, this is measured by the number of orders in CPT code range that are in the completed status that have an electronic result, manually entered value, or an associated document fax. Exclusion: an EP who orders no lab tests whose results are either in a negative, positive, or numerical format during the EHR reporting period. Other information: structured data does not need to be electronically exchanged in order to qualify for the measure of this objective. The EP is not limited to only counted structured data received via electronic exchange, but may count in the numerator all structured data entered through manual entry through typing, option selecting, scanning, or other means. Now let's look at how a lab test gets added to the denominator population. The lab test order is added on the Orders and Procedures page of the EMR. Now select an order in the CPT code range for lab orders. Now click the Add as Orders button. The test will then be added to the denominator population for this measure. Now I'll enter a result using structured data, but enter it manually. Select the Enter Result right-click menu item. On the Enter Results page, enter the value for the test result. Click the Submit button and the value is entered. The test is then included in both the numerator and the denominator. Most electronic tests are received in the Waiting Room Solutions system electronically through a laboratory connection to an external reference lab. Results returned electronically appear in the completed status in the order tracking system. An electronically returned result appears in the order tracking queue, as well as the Orders and Procedures page of the EMR. Here we see an electronically returned blood glucose level from a basic metabolic panel. By receiving the results to this order electronically, the test counts toward the numerator. No specific action is required for this to happen other than establishing a lab connection. Now let's run the Meaningful Use report for this measure. Here the results are displayed. In conclusion, the three methods for demonstrating meaningful use for this measure in the WRS system include manually entering in a discrete lab value, receiving an electronic result in the WRS system from an external lab, and receiving a fax that is matched to a laboratory order.